Testosterone in women. That's the topic we're going to be diving into in this 3-part series that I'm making around a topic that is unfortunately very underappreciated and under-recognized in the medical community. We're going to be getting into the symptoms of low testosterone, what are the causes of low testosterone in women, what lab values we should be expecting and how we can approach blood work, and what can we do about it, because that's obviously the most important thing at the end of the day. And so in part 1, we're going to be covering the causes and the symptoms primarily, and then we'll get on to the other topics in parts 2 and 3. My name is Dr. Omar Akhter, and I'm a MD and a board-certified internist with a private practice in Austin, Texas that takes a holistic approach to chronic disease with a specific focus on hormone optimization. So this is a topic that I see regularly and an issue that I deal with regularly in my clinic, which is that when women come in, they have many symptoms, but one of the symptoms and one of the issues that they have can pertain to testosterone. The main thing is, how do you identify it and what can you do about it? So that's what we're going to be discussing. So the first thing is to understand what are the main symptoms of low testosterone. How does low testosterone present in a female? And I think the biggest clue is usually going to be decreased energy or fatigue, especially with afternoon crashes. So, think of the woman in her 30s, 40s, 50s who is kind of chronically tired, afternoon crashes, having to take a nap, and then add on to that a low libido, which is low sexual desire. Okay, and that can be represented as a low desire to initiate intercourse, or it can be the lack of achieving orgasm or various other sexual issues. So a decreased energy and low libido are big ones, but also decrease in muscle mass. So think of someone who is basically trying to work out and trying to put on muscle, but not able to, or not proportionately able to. That can be a sign of low testosterone, because testosterone is so important in muscle formation. And one of the things that happens with low testosterone is what we call sarcopenia, or muscle wasting, that can happen down the road. So there is decreased energy, there is low libido, there is decrease in muscle strength or inability to put on muscle. There is decrease in vaginal lubrication as well. Okay, so all of these things, when you put them together in the right context, can represent low testosterone. Now, in women, we have to find out why the testosterone is low, or know what the causes are. So number one, what needs to be understood is that testosterone levels are going to decline over time. So you're going to have a steady and gradual decrease of testosterone over many years, starting from your 30s, going on to 40s and 50s. And eventually, when you get to menopause, then that testosterone level is going to be extremely low. So testosterone replacement often becomes an important issue at that point. And it's also important before that, but as time goes on, testosterone levels decline further. So we need to know that age is one cause. The other cause is to understand that all of our foundational aspects of our, everything from diet to exercise, poor sleep, and stress, high stress, all of those things will contribute to hormone imbalances, and in this case, low testosterone. So there can be that correlation. So addressing these foundational issues often becomes important. So we covered age, we covered a lot of these foundational issues like diet, lifestyle, that's going to be important. And then when women are on birth control, for example, this is an important cause to understand that a lot of people don't talk about, which when you're taking oral contraceptives or oral birth control, then you increase something that's called sex hormone binding globulin, or SHBG for short. Sex hormone binding globulin is that protein made in the liver that will really tightly bind to the estrogens and the testosterone. So when it tightly binds to it, it decreases what we call free testosterone. Free testosterone is that small percentage of testosterone that is bioavailable or available to basically do all the functions of testosterone. So so as you take oral contraceptive pills, the SHBG goes up. So there's an increase in sex hormone binding globulin. When there is an increase in sex hormone binding globulin, more testosterone is tightly bound to that sex hormone binding globulin, leaving less free testosterone available for the body to utilize, and hence you get low testosterone. So those are some of the core common causes of low testosterone. Now, we looked at symptoms, we looked at causes. Now, I want you to understand that there is the way that testosterone is dealt with in the US is that for men, the guidelines by the FDA have been very, very strict and restricted to a certain number. And that number is usually 300. 300 is the testosterone, the total testosterone number, below which, if you're at 299, then you have low testosterone and you are sort of approved for testosterone replacement. If you're at 301, you're considered normal. And so this is one of the problems, to have such a hard cutoff and an arbitrary cutoff. That cutoff has no indication in the literature or evidence based on that. So I think the main thing is to understand that in men, testosterone is the arbitrariness is it's cut off at a certain number. In women, unfortunately, it is approved only for one. Low testosterone is understood in only one context, which is what's called hypoactive sexual desire disorder. Okay, so HSDD for short, hypoactive sexual desire disorder, which is a very, very specific and strict criterion of low libido, of what we're talking about as low testosterone. And if women fall within that category, then they would be able to qualify for certain FDA approved medications. But it's important to understand that testosterone replacement is not FDA approved for women in the United States. That does not, however, mean that the studies have not shown benefit for testosterone use in women. Studies have absolutely shown benefit, but for various reasons, a lot of economic and political issues, the FDA has not approved testosterone for women in the US. So a lot of times when it's used in an off-label fashion, which means that it is used, basically you can use it for a reason that the FDA has not approved. However, it is still very, very relevant and present in the literature. So that's important to understand. And I'm going to do a separate video on hypoactive sexual desire disorder and some of those definitions, and we can get into those criterion. But here I just wanted to touch on that entity, because in women, unfortunately, if you're just considered low testosterone, unless you very, very neatly fit into that category of hypoactive sexual desire disorder, it's really not considered a problem in mainstream medicine. And that's unfortunate, because a lot of women then suffer the consequences and they don't find relief for their symptoms. So again, to recap, we talked about symptoms of low testosterone being decreased energy and fatigue with afternoon crashes. It's going to be low muscle mass or inability to put on muscle. It's going to be decreased vaginal lubrication. It's going to be low libido, decrease in desire. It's going to be even bone health gets affected as well, which is something that we need to talk about as well. And just general sexual side effects that can occur. So these are all the things that I wanted to mention in part 1. Stay tuned for part 2, where we're going to discuss, get into blood work and discuss what blood work should be done, how should we approach blood work, and what are sort of the optimal ranges that we would consider when dealing with testosterone in women. And then we'll do a part 3 with some of the treatment options.